And your focus, as it has been for a number of days now, you and I have been talking about it on air, and then you took that questioning as well about the need to get jabs in arms. That's the simplicity of it, isn't it?
It is, Kieran. So the push is on to get AstraZeneca jabs into the arms of essential workers in southwest Sydney, that COVID hotspot, as the New South Wales government appears to recalibrate and begin to crab walk away from their commitment to reopen after lockdown only if there are 0 cases of people infectious in the community. For a while now, it's become clear that there is a need to get as many vaccinations as you can into the essential workers coming from the southwest, and that you should deploy as many jabs as you can into those people. At the Fairfield Showground and other testing centres, where essential workers going to other areas are being tested, required to test every 3 days, can't we get these workers who are fanning out into other parts of Sydney vaccinated while they're being tested? New South Wales Chief Health Officer Kerry Chant indicated this was an option being looked at and that there would be more vaccine hubs announced tomorrow. She also said that if they had the doses, like more Pfizer become available, the New South Wales government could administer 350,000 jabs a week. Given the population of local government areas hit by the virus is more than 1 million, this might not even be enough. You've got kind of a captive audience with those workers having to go get tested every 3 days, a lot of them at the Fairfield Showground and so forth. Could you not vaccinate them with AstraZeneca at the same location? Could you not set up several locations like Belmore Oval, etc., and kill 2 birds with 1 stone?
Look, I think we're looking at all options. It's important that we don't mix our testing where people, there'll be a mix of people going for testing. Some people will have symptoms and some people won't. So obviously we've just got to make sure that we don't pose a risk of infectious people, but all avenues, and I think you make a really good point that we're really focused on workers that are particularly mobile and particularly having to provide that critical infrastructure. And as I said, I would encourage everyone to take up any opportunity to get vaccinated. So I think that we could well have a very rapid push of well over 350,000 just ourselves if we had the opportunity to do so. So really it is about supply constraint of the Pfizer vaccine.
With the COVID-19 numbers today, again over the 140 mark, and the current level of restrictions not budging that number, I can't see lockdown restrictions not being in place until perhaps the end of October. Victoria, we know, was locked down from the start of July to the end of October. It had many more daily cases at the peak, 6 times more in fact, but it wasn't Delta, and they had a curfew. Alarming is that Kerry Chant said there was a poor take-up of AstraZeneca by over 60s who were simply refusing to get that jab, so that's not helping matters. In terms of that 0 target, which looks out the window, here is Police Commissioner Mick Fuller from my interview with him for Sunday Agenda saying he can't see New South Wales getting to 0, and then Dr Chant today refusing to commit to the 0 target.
The way the Delta variant is running through, particularly Sydney at the moment, is that I can't see us getting down to 0 for some time.
Is it your view that tight lockdown will need to be in place until we get down to 0 or as close to 0 cases in the community?
The Premier indicated that those discussions are ongoing about the path before, but I think what we've learned is with the Delta variant, you don't have much leeway. It is such a highly infectious strain of the virus, and because we're tackling an issue that whenever we get to a case in a family, the family's already been infected or inevitably over the next couple of days will become positive. So it has no grace. With the previous strains, we could get to people early enough. And so I think with that challenge, we need to ensure that our approach aligns with that.
So no recommittal there, something of an omission, I think. So as I reported yesterday, there is a division between an unofficial view at the highest levels of the federal government that New South Wales has not locked down hard enough, a view publicly stated by the West Australian and Victorian premiers, and the view on the other side from Berejiklian that she needs more Pfizer in southwestern Sydney. So my mail is that the feds have been eager for some time for Sydney to adopt tougher restrictions. Politically, Gladys Berejiklian seems to believe it is poison to toughen restrictions, politically, Scott Morrison, the PM, feels probably justifiably it is poison to take vaccines off other states and other premiers. And other premiers think it is politically poisonous to give away their promised Pfizer supplies and give it to New South Wales. As much as the health advice comes into play and our leaders quote it relentlessly, the political advice plays a big part into how to handle this. We keep hearing Gladys Berejiklian use the term safely and freely. This, New South Wales government sources tell me, is a phrase that comes out of the Liberal Party pollster Crosby Textor's focus group, safely and freely. Again, it's about political considerations for all the leaders, not just health advice. From what the New South Wales Premier said today, she seemed to indicate she'll go softer in some areas and harder in others when she makes a lockdown announcement later this week. Could a curfew for some local government areas be put in place, for example? I asked Berejiklian if she would rule out a curfew. She said it didn't work, and then Kerry Chant did appear to back tougher restrictions in some areas.
Look, they haven't demonstrated they work.
Can I ask Dr. Chant, if you had curfews, if you brought in the 10K to 5K, would it have any effect on mobility? Would it have any effect on the virus?
So there's a number of areas that we've identified as hotspot areas, such as the local government areas, and they've got restrictions on staying within those local government areas, either the suburb or the local government area. So there's actually quite a lot of restrictions on people's movements. There's a restriction on travel for recreation, and we do ask people to move locally. And from a public health perspective, we're looking at, we're engaging with a wide range of experts. And again, we're not afraid of putting up a range of options.
So I put to Premier Berejiklian what Scott Morrison said in the Parliament on June 23, 3 days before the lockdown, when he commended the New South Wales Premier for not locking down, and whether he had lobbied her in recent days to, ironically given that statement, go harder.
The Prime Minister on June 23rd said in Parliament, I commend the New South Wales Premier for the way that she is handling the outbreak in New South Wales, the fact she hasn't gone to lock down Australia's biggest city. He said that was a positive decision. Yesterday, he said, the lockdown comes to an end by the lockdown effectively working. There's not an easy way to bring these cases down. The lockdown does that work. The vaccines can provide some assistance, but they are not going to end this lockdown. Can you see the contradiction in those messages? And before the first lockdown, did the Prime Minister encourage you in any way to avoid a lockdown? And in recent days, has the Prime Minister attempted to encourage you in any way to tighten the lockdown?
I think what's really important for the people of New South Wales to know is that the decisions our government takes are based on the best health advice. I learned very early on in this pandemic that the best way to support our citizens, to keep them safe and to allow us to live as freely as possible is to base all of our decisions on their health advice.
Has he lobbied you on either front or encouraged you on either front?
Can I be honest and say a lot of people have given me a lot of free advice, but the best advice that I will continue to rely on is that of Dr. Chan and her team, the New South Wales health experts.
So she says she gets a lot of advice, doesn't say if she gets some from the Prime Minister, but Kerry Chant is really the arbiter of her decisions. So having called on Friday the Sydney situation a national emergency, having then been rebuffed by National Cabinet on getting Pfizer from other states, Berejiklian indicated today she would not even bother with Daniel Andrews, the Victorian Premier's offer to provide modelling showing New South Wales restrictions were working, in which case he might give her some vaccine.
Dan Andrews has said that if you showed him modelling which shows the lockdown is working, he'll give you some Pfizer. Are you planning to enter negotiations with Victoria on that if we're desperate for Pfizer in New South Wales?
Look, Andrew, can I say that National Cabinet made their view very, very clear to me on Friday. I argued my little heart out, but the position of the National Cabinet was very clear. I'm someone who'll always fight for New South Wales, but I'm also someone who'll work with what we have.
So it seems she's given up on the Pfizer. I asked the Premier, is it still a national emergency, or has she thrown in the towel on getting Pfizer from the other states?
Sorry.
On Friday, you called this a national emergency. Do you stand by that description? And if that's the case, it sounds like you're throwing in the towel on asking the states, continuing to ask the states for Pfizer. Are you going to keep going on that?
Look, Dr. Chant and I were simply making the point, when the largest state is facing a serious outbreak, it is an issue of national significance. And that is the point we're making. And the point we're making is that we do need to refocus our energies on the vaccination strategy alongside, not replacing, but alongside the lockdowns and the restrictions that we'll have in place. And that is key. What we're doing is just simply stating the facts that we've been a state that's managed to hold off all strains of the virus. The Delta is a complete game changer.